Upper limb. We are coming to the end of anatomy discussions. Remaining main topics are upper limb, lower limb, then abdomen. Now we will discuss about upper limb. We will fastly complete the topic. Don't worry. Upper limb. Coracoclavicular ligament transmits the weight of upper limb to clavicle. Coracoclavicular ligament. It is located between clavicle and first rib. It transmits the weight from clavicle to axial skeleton. Clavicle. Clavicle is the only long bone in the body which is disposed in horizontal direction. It is only long bone having two primary centers of ossification. It is subcutaneous throughout. It does not have bone marrow. Most common site of fracture at junction of medial 1/3 and lateral 2/3 of clavicle. Relations of clavicle: medially sternoclavicular joint, saddle synovial joint; laterally acromioclavicular joint, pain synovial joint. Below the lateral 1/3 of clavicle, coracoid process of scapula. Sternoclavicular joint and acromioclavicular joint is involved in abduction of shoulder. Types of epiphysis. Pressure epiphysis. It is for weight transmission. Include head, capitulum and trochlea of humerus. Traction epiphysis. It arises because of pull by some muscles. Examples are greater tubercle of humerus because of sits muscles. Sit supraspinatus, infraspinatus, teres minor. Lesser tubercle of humerus because of subscapularis muscle. Medial epicondyle of humerus because of flexor muscles that take origin from here. Lateral epicondyle of humerus because of extensors and posterior forearm muscles that take origins from here. Atavistic epiphysis, a bone that is independent of phylogenetically and is now fused with another bone. These types of fused bones are called atavistic. Coracoid process of scapula is atavistic epiphysis. Aberrant epiphysis. Each metacarpal has one epiphysis at the head, but epiphysis of first metacarpal is at base. But in some people, there is one additional epiphysis at the head of first metacarpal. This is known as aberrant epiphysis. These epiphyses are deviations from normal and are not always present. Brachial plexus. Cervical enlargement of root value C3T2. Root value of brachial plexus C5, C6, C7, C8, T1. Brachial plexus is lying in neck region and passes behind the clavicle bone and enters the axilla. Roots and trunks lies in neck region. Divisions pass behind the clavicle. Cords and branches lies in the axilla. 5 roots of brachial plexus join to form upper, middle, lower trunk. Each trunk gives anterior and posterior division. Therefore, 3 anterior and 3 posterior divisions. There are 3 cords of brachial plexus named according to the relationship with axillary artery in the axilla. Lateral cord will continue as musculocutaneous nerve. Posterior cord will continue as radial nerve. Medial cord will continue as ulnar nerve. Lateral cord as musculocutaneous nerve. Posterior cord as radial nerve. Medial cord as ulnar nerve. Long thoracic nerve to serratus anterior comes directly from roots of C5, C6, C7 in neck region. Schematic diagram of brachial plexus. Roots join to form trunks. Upper trunk C5, C6 supplies the upper muscles like shoulder, scapula and arm muscles. Middle trunk C7, lower trunk C8, T1. Upper trunk C5, C6, middle trunk C7, lower trunk C8, T1. Erb's palsy C5, C6 are compromised. Clump's paralysis C8, T1 are compromised. That is, the lumbricals and interosseous muscles are compromised. Root values for various nerves. Musculocutaneous nerve C5, C6, axillary nerve C5, C6, ulnar nerve C8, T1, radial nerve C5, C6, C7, C8, T1, median nerve C5, C6, C8, C7, C8, T1. Upper trunk gives two branches in neck region. Suprascapular nerve to subclavius muscle. Important information: radial nerve and medial nerve have all 5 root values of